So for the elbow, we're going to typically move and use a 10 offset, unless it were, say, like a very small breed dog, then I might use a 2 or a 5. But, you know, for him, I think 10 is going to be great, because if you think about it, you know, with the 10, for example, this is the direction, this is how much, and if we're going to treat the elbow, you know, if we look at just the width of the elbow is about like this. And so that's going to get us, you know, if we're going to treat medial and we're going to treat lateral, then we're going to be able to hit the entire aspect of the elbow. And so most cases of dogs with elbow disease, they are typically affected more medially. So a lot of the time the attention is going to be more on the medial aspect of the elbow. But then we can also treat laterally, because dogs can get some degree of flexor and extensor tendinopathy, especially dogs with chronic OA. And so with the elbow, what I'm going to do is I'm going to find my epicondyles, and I'm going to go just a little bit further distally and a little bit further cranially to that. And I'm going to kind of direct my probe craniomedial, craniolateral, caudimedial, and caudilateral to the epicondyles. So if you think about it, you've got your epicondyles. I'm going on either side, kind of 4-quadrant, very similar to the stifle. If they've got some direct discomfort on the biceps inserting, we can also go straight cranial on the bicipital insertion here, because some of these dogs will get discomfort on the insertion of the biceps. So very similar way we're going to do is apply our ultrasound gel. So I can feel my epicondyle. We're going to treat caudal. And then I can come around and I can go craniolateral. And then if we need to go to the medial aspect, we can add some more ultrasound gel. And again, I'm going to palpate my landmark, which is my medial epicondyle. And then we can treat medially. So I'm going craniomedial, and then I can switch to caudimedial. If we have triceps pain or discomfort, we can also treat in the region of the triceps. We would just split the hair to get down to the skin. And we can treat right at the insertion of the triceps. And I'm just going to go proximal and distal, and I'm going to sort of treat on the lateral, the caudal, and the medial aspect of the triceps.